Hello, this is Dr. Mike Couch, the Catalyst at CaringQuest, and I am pleased to welcome you to the first part of a three-part webcast. Having been a student of this great profession for 40 years now, there is a problem we have become alarmed and concerned about over the past several years. It is what we call a lost treasure, the health of the dentist and dental team. So let's get started. We begin with a question. What do a frog, cigarettes, and most traditional dental delivery systems have in common? We've all heard the story of a frog and a pot of boiling water. If you throw the frog into a pot of boiling water, it will react and jump out. If, however, you take the frog and put it in a pan of cool water and slowly increase the temperature, the frog will adapt and in the end get cooked. Over time, cigarettes and tobacco can also be hazardous to your health. And after 40 years of sit-down dentistry, we now know that most traditional delivery systems can cause chronic health problems. At the end of a typical day of delivering dentistry, do you ever feel like this?
Oh, my neck's killing me. Oh.
Dentistry creates multiple challenges and problems for the physical health and well-being of the clinician. Three of the most prevalent challenges are neck, back, and shoulder pain, eye strain, and reduced productivity. So who's watching your back, neck, wrists, shoulders, and eyes? Pain is something we all live with, but a dentist is more likely to live with it longer than any other professional in our society.
Incorrect posture creates stress on pressure points that, if done repeatedly, can cause lifetime and sometimes incorrectable problems. Research states that it takes 150 movements by the dentist per procedure, pulling and replacing handpieces to the control. This creates tremendous stress on the operator. His ability to focus visually and mentally on his objective of quality dentistry is disrupted. Repeatedly, he has to move from the oral cavity to the handpiece control. Over a period of time, research shows that this not only creates a mental stress, but a physical stress on the lower back, the neck, and causes eye strain refocusing from the oral cavity approximately 18 inches from the eye to the control, which is approximately 36 inches from the eye. In addition to the physical and mental stress that the traditional sit-down dentistry system causes the dentist, it also affects the effectiveness and production level of the assistant. With traditional sit-down dentistry, vacuum controls are situated at levels that, although being adjustable, still cannot come within easy reach of the assistant. The assistant must turn approximately 90 degrees to grasp the vacuum, and then lean away from their center of gravity to see and work near the oral cavity. This movement causes strain on the pressure points of the lower back and the neck areas. It also prevents the assistant from easily working with the operator in handling instruments while at the same time controlling vacuum suction procedures.
Let's take a look at some of the statistics. 59% of dentists report musculoskeletal pain. 75% of all dental care providers complain of one or more carpal tunnel symptoms, and 50% complain of back and shoulder pain. 87% have problems with eye strain. Work-related musculoskeletal disorders, or WMSDs, are the reason for an early retirement of 29.5% of dentists. We believe for hygienists it is that and probably more. These issues are compounded for a number of dentists whose retirement plans have been adversely affected by the economic challenges of the last decade. Many dentists are faced with the need to extend their careers at a time their bodies are dealing with the wear and tear of 30-plus years. With these challenges and issues many dental professionals deal with, if we could turn this around, what would the desirable outcomes be? The outcomes can typically be categorized in three areas: health, stress, and productivity. So our best solution would be to improve health, reduce stress, and increase productivity. I bring you good news. There is a solution. Almost 50 years ago, from 1963 to 1986, grants of approximately $25 million were invested on research and then teaching the solution to 1/3 of U.S. dental schools. The bad news is too many clinicians did not learn about it or have forgotten the solution. However, the great news is the principles and fundamentals are still valid and invaluable. Help and health are available. So what is the answer to the question?
Four-handed dentistry was designed by the University of Alabama at Birmingham to improve the methods of dentistry.
The dental schools at the University of Alabama, Birmingham, University of Michigan, University of Texas, San Antonio were some of the earliest developmental programs involved, and about 1/3 of the dental schools at the time followed suit and participated in the grant monies. In the late 70s and early 80s, I was fortunate to direct the program at the University of Colorado School of Dentistry with a $250,000 annual grant. So knowing the desired outcomes and the answer, how did we get into this mess? First, in the mid-80s, the grant monies ran out, and the dental schools let the teaching of the four-handed curriculum dwindle or die altogether. As a result, all the research and science was largely ignored in dental curriculums. Clinicians' health and productivity were not subjects of dental education. Finally, with the principles and standards being lost, the mainstream dental manufacturers created their own answers. In hindsight, what do the results tell us? Our education and support systems have failed us. So where can we go from here? We begin with the building blocks discovered as a result of all that great research. Those building blocks are a properly positioned team and patient. Most dental teams sit down today, but studies show positioning is usually improper. Full utilization of the assistant, much like a surgical nurse. This should not be confused with assisted dentistry, which most people practice. Workflow and workspace organized around functional zones of activity. Work simplification built on motion economy. When the delivery of care is built with a foundation of these building blocks, the desired outcomes of improved health, reduced stress, and increased productivity are achieved. The result is a happier, healthier environment. Through the years, some great resources on four-handed dentistry have been created. The Four-Handed Dentistry Manual from the University of Alabama, Birmingham School of Dentistry. Dr. Harold Kilpatrick's seminal publication, Work Simplification in Dental Practice. Dr. Joe Chastain's Four-Handed Dentistry in Clinical Practice. And Betty Finkbeiner, one of the preeminent authorities on four-handed, has a great book, Four-Handed Dentistry. A Google search for four-handed dentistry will lead you to other resources available to you. We have used our experience in these resources to create this and the next two parts of this webcast. We thank you for your time and invite you to join us for Part 2, The Answer, True Four-Handed Dentistry, on our mission to improve the health and well-being of the dental team.